Welcome back, and thanks for staying with us as we get into the last part of our town hall discussion here on the Monday Report at the Panari Hotel in Nairobi. I want to give my audience members a chance to ask one or two more questions before the panel summarizes this all for us, because we cannot finish this conversation today. Dr. Nyikala has promised us next time we start at noon, we take it up to 6 p.m. Maybe, just maybe, we'll have scratched the surface. But for today, we have to deal with what we have. Let's get those final questions in briefly, please, and I'll be very strict with this. Start with your name.
Okay, I'm Hawkins Capel. I want to know that what is the government doing to solve the standoff between USAID so that the person living with HIV can start getting access to ARVs and its commodity. My final question is,
no, I can only take one. I can only take one.
Kindly.
In the interest of time, let me take one.
The last one.
You risk it not being answered. Okay, go ahead.
Thank you. What is the government doing so that the shortage of condoms in the country can be solved? Thank you very much.
Okay. Thank you. Let's take another one.
Thank you very much.
The microphone, Tafadhali.
Thank you very much.
Go ahead.
I'm Frederico Biambo. Volunteers. I have a question on UHC. That is when they're likely to be operational for the communities in Nairobi. And also about, again on the USC, I've also had the question of whether it will cover all the illnesses, taking into account that those people targeted are living in poverty and also people who are unable to take care of themselves. Thank you.
Thank you. I'll take one more. Do we have the microphone? Okay, go ahead.
My name is Hesbon Mogeni from Kawangware. I'm also a health frontier. So my question is, let me speak in Kiswahili so that others can understand.
Tafadhali endelea.
And ningeuliza, like now, CHVs akina mama wetu wenye walikuwa kutoka kitambo.
Naomba ushike mic vizuri ndio tukusikie.
Akina mama wetu wenye walikuwa health frontiers from kitambo, from back 2000, imefika wakati wamepigania wapate kakitu, so imefika mahali wameanza kuwekewa barriers about education, whatever qualifications. So as a Minister of Health, watasaidia acha akina mama wamepigania hiyo nafasi hata wakati huu wasiwekewe barriers. Sababu wanafanya kazi mingi kule mtaani.
Asante sana kwa hiyo swali ya mwisho, tafadhali, na ujitambulishe tafadhali kwanza. Wewe mwenye uko na microphone.
Habari zenu?
Salama.
Mimi naitwa Jane Modoni na ni CHV Kawangware. Swali langu ni kuhusu mambo na Linda Mama. Linda Mama ni kuprotect wa mama wale wenye wanaenda kupata watoto. Katika community yangu kuna so many issues ambazo zinatokelezea kuhusu mambo ya Linda Mama. Wamama wakienda kujifungua, they are not getting ile yenye inaitwa kulindwa. Kwa sababu wengine wanakuja, kwa sababu mimi ni CHV na nilimwambia aende akajiandikishe ndio aweze kusaidika kwa hiyo Linda Mama, anakuja ananiambia, "Jeni, unajua nini? Mimi sitakuwa naenda huko tena, hata kama nikupata mtoto mwingine sitaenda huko tena, kwa sababu vile tunatakiwa tutritiwe sio vile. Kule wanaenda mambo yao haiendi sawa. Wengine wanaambiwa hata wanunue vitu ndio wahudumiwe." Unaona? So tuko na shida kama CHVs, tunashindwa tutaenda kuambia wamama wetu namna gani ndio waweze kwenda kujiandikisha kwa hii program ambao inatakiwa ilinde mama, whereas they are not being protected.
Asante. Thank you for that question. In the interest of time, we're now unfortunately going to have to take responses as we conclude. So PS, I'll start with you if you want to respond to any of those questions and your final comment on this. A lot of the questions they're asking aren't just about all, the so-called urban counties, but the rural counties as well that your ministry represents. What is being done to address some of the issues being raised?
Okay, thank you so much, Maura, and thank you, the audience, for those concerns you have raised. If I may mention what is happening in the arid and semi-arid lands, if I may take an example, in most of the arid counties, we have been having our mothers, just picking up from what the last person who asked a question. If I may take on the ladies or our mothers who are going to deliver in hospitals, statistics show that the number has really increased because of the improvement of the infrastructure. Just as a parting shot, Dr. Nyikala has spoken so passionately about the causes of the causes. As a ministry, what we are trying to address is developing resilience. Right now, we are developing a document on resilience programming framework to look into how can we address the stressors that are affecting, be it COVID, be it drought, be it water or anything. We are developing a resilience programming framework so that our people are resilient. Once our people are resilient, once you have food, once you have nutrition taken care of, your body is able to fight with any kind of diseases that are coming. If COVID hits you and you're not feeling, and you're not nutritive, your nutrition is not proper, then you're going to go down. So what we need to do, what we are doing is to have resilience in our communities, especially in the arid and semi-arid lands. Thank you so much.
Yes, some Kenyans are saying we have too many programs, too many frameworks, too many guidelines. What guarantees can you give Kenyans that those programs you're talking about will actually impact people on the ground?
Let me guarantee you, at the moment, we are having so many resilience programs which are going on in the arid and semi-arid lands.
Okay.
One, if I may quote some activities which are happening in Turkana. For the first time, we are able to harvest crops in Turkana County, which is as a place which they don't have, which they have not been growing food. The other day I was in Wajir. We are having great animals being kept there. So this is providing resilience. The dairy goats are being, through Kenya Smart Agriculture, we are having dairy goats down there. We are having animals. We can provide milk to the communities, making these communities resilient. So it's workable, and I may request we take a tour to some of these places in Waiga, so that you can, instead of sitting in such a town hall meeting, we can hold it in Wajir or Garissa or Mandera.
We accept your invitation. Yes. We look forward to actually going there. Thank you, and thank you, PS, for that. Senator, even as you respond to one or two of the questions, somebody asked, ultimately, who holds duty bearers responsible for the success of UHC, NHIF, etc.? I believe you and this gentleman here would have a say in that. Please respond to that even as you give us your final thoughts, and may I add briefly, if possible. We are out of time.
I hear you, Wahiga. Accountability, definitely Parliament has a big role to play in accountability, and I know Dr. Nyikal here, Mheshimiwa, is going to speak more about it. And I'll just give a brief on the work that we did as ad hoc committee on COVID. In fact, it was our committee that raised the issue of COVID billionaires. The big news on COVID billionaires hit at the time when we were still sitting. And up to today, even after all the investigations that have been done, we still don't have a conviction on KEMSA scandal. It still hangs out there, and it's still an elephant in the room. And here we are. We are discussing UNHC and the success of UNHC. How successful then is it going to be if we are not going to make sure we seal all the loopholes where money may be stolen, money that is meant for services for people. So I do agree, accountability for Parliament, but there are other organs and other mechanisms that are still out there that have to work in tandem with the work that Parliament does to make sure that we hold everyone to account for all that money, and all the organizations are held to task to account for their monies that is meant to be for UHC. And just so that I can wrap up, there's been a lot of conversation on teenage pregnancies. Teenage pregnancies are a real issue. It's a big societal issue that we need to discuss as a society, because these come out of, just societal issues. And in fact, it came to my knowledge because I was invited as a keynote speaker for a trust and a movement called Protecting Life Movement that is led by Dr. Jean Kagia. And I learned, and what they do is actually rescuing teenagers who are pregnant and who have been rejected at home. And you can imagine now that impact of that child after rejection. You don't know what to do with the child, and abortion is not in question here. So we are protecting life. At the same time, we are rescuing teenagers, and there are lots of teenagers that are going through this issue. And this is a conversation, Wahiga, that we need to have as a country. But more importantly, I learned that we don't have any policy towards protecting teenagers who are pregnant. And that one, Dr. Mwangangi, is a conversation we must have. I think we have work to do next year. Once Parliament resumes, we'll raise certain questions in the hope that we can get more mechanisms to safeguard our teenagers and this societal issue that has really become a big issue. So thank you very much.
Thank you, Senator, for that. Dr. Nyikal, your final thoughts, and since I gave you so much time previously, I will limit you now, unfortunately.
Just one thing about USAID and standoff. I think there's work going on at KEMSA to actually find out what happened and what the USAID as a partner would like us to do. I went through that in 2005 and we resolved it. I think they should be able to resolve it. Mama Linda, it is again, we may have all these things we want to do, but if we do not have the facilities and the knowledge in the community, the mother will not get there. And to summarize, basically what we need is human resource, financing, and governance. And that governance will come out accountability. CS will tell you, we do call them from time to time and put them to task. Why has this not happened? Parliament has that. We are elected by the people. We must put the ministries to task. We do. But sometimes we make recommendations, and then there are agencies, like she said, Parliament does not take people to court, nor does it arrest people and take them to jail. So when we make those recommendations, we say what they should be done. Really, if institutions work, that should be taken over. But my summary is, identify what you want your people to have. Get human resource, get supplies, finance it, and do governance, including fighting corruption, will be there.
It sounds so simple, Dr. Nyikal, and if it was, we wouldn't be having this town hall. But thank you for
we are not determined.
Maybe that's the last part you needed to add. The CAS, you have the final word. What's it going to be?
Thank you. There's so much to talk about when it comes to UHC. I think the first thing is to say, yale malalamishi ambayo umetuletea tumeyasikiza. Tumefanya utafiti mwingi kuhusu huo mradi wa Linda Mama. Na yale ambayo umesema ndio ni ukweli. Lakini jambo lile muhimu tunafaa kufanya moving forward. Hii pesa yote, and I think someone asked what's the budget for UHC. Part of what we are going to be doing going forward after the enactment of the NHIF bill is we're going to integrate all the small programs. Someone said we have too many programs. The Linda Mama program, the Under 5 program, the health insurance subsidy program for the poor, all these will be integrated into one program that will ensure that Kenyans are covered, particularly those who require subsidies. Tukifanya hiyo integration, you'll see the challenges that women are facing will cease to be. One important thing that Kenyans must realize, a journey starts with one step. Step by step, and I can tell you, having been in this sector for 12 years, not longer than Dr. Nyikal here, but 12 years is a good enough time to understand the sector. We have made gains, but we can do more if we are determined, and we are determined, Dr. Nyikal. And so really walk with us in this journey. It's a step-by-step journey. Remember, when you're building a house, you can build a house of 3.5 million, you can expand it by 5 million, you can build a house of 50 million, but it's a journey. Step-by-step journey, and that's what UHC is. And I really do believe that our country is well on the path to that, particularly once the president signs on to the NHIF bill, then truly his legacy will be sealed when it comes to UHC. And it's a journey, step-by-step, one foot ahead of the other.
Thank you. Okay, a round of applause to my panelists, and of course to the audience as well, which has had its fair share of experts. My goodness, what a discussion we've had. Clearly we needed more time, but we're going to have to leave it here because we're practically into the next day. I need to let people go home at this time. Let me thank each of my guests here. We've had Mika Powon, who's the PS ASAL under the Ministry of Public Service Gender. Thank you for joining us today. Together with Senator Sylvia Kasanga, who chaired the ad hoc committee on the COVID-19 response. Asante sana. A very passionate Dr. James Nyikal, who is MP Seme, a member of the Health Committee and held previous roles in government in regards to healthcare. And thank you, Dr. for sharing your thoughts today. And of course, Dr. Masi Mwangangi, CAS Health as well, for your time. Plus the experts that we've had in the room representing different civil society groups, organizations, grassroots organizations as well. You are the people who made this discussion possible, posing the tough questions to the panel here. And this is a discussion we'll continue to have into the new year as well, because we now need follow-up on the promises that have been made here in regards to what the next year could look like. I finish with a quote from our Constitution, Article 43(1), which says that every person has the right to the highest attainable standard of health, which includes the right to health care services, including reproductive health care. Whichever part of the country you're watching the broadcast from, if that isn't happening, then those in charge are in breach of the Constitution. And that's a discussion we must continue having on the program. Thank you for tuning in. Wherever you've watched from, too many messages. The UHC one, you need to do something about that, CS. I'm going to leave that to you. It keeps coming up. Please go to the ministry and have that sorted. And we're going to leave it here. My name is Wahiga Mwaura. On behalf of the whole team that's made this possible and a host of partners who've also made this production possible this evening, thank you for tuning in. Have a good night. Dare I say, stay safe and stay healthy. We'll see you soon. Goodbye.